Joining us now to discuss this second launch is CBS News political director John Dickerson, who joins us now from our Washington bureau. John, good morning.
Good morning.
So officials seem like they're being very cautious with their wording here. They're saying it's not a relaunch. This is not a magical date. So what exactly can we expect today?
Well, I think that's right. I think they want to keep expectations very, very, very low. What we can expect is more people being able to sign up, getting from the very beginning of the process all the way through the end to picking a plan. But we really aren't going to see any real indication if things are much, much better, probably well into next week. When there are, if it's working, lots of stories of people being able to move through this smoothly, or if it's not working, more of those horror stories that we've become accustomed to.
John, if the website is fixed, does that mean that the system is essentially fixed?
No, and that's the crucial distinction. The administration has said that the vast majority of users will be able to use the website after this fix is made. But the website's only part of the issue here. What needs to happen once you've picked a plan is that information then has to get translated over to the insurance companies. And that's where a big problem has cropped up. And basically what happens is either the insurance companies get bad information, they get duplicate information, or sometimes there are these things called orphan records, where somebody's picked a plan, but no information at all gets to the insurance companies. That is a crucial step. And so the website can be fixed, but the system may not be fixed. And so that's something we're going to be looking at very closely in the coming weeks.
We've been witness to so many bumps along the way. And the day before Thanksgiving, there was a quiet bump. We very quietly heard that the launch date for federal health exchange for small businesses would be delayed by a full year. So what else could go wrong at this point?
Well, the menu of things that could go wrong seems to grow and is unexpected. This is one thing that the administration knew was an issue, and so they decided to just basically kick the can down the road on that, the same way they did in near the 4th of July when they basically extended the employer mandate for a year. That was for companies with over 50 employees who had to buy those employees insurance. They said, let's put off that mandate for a year. One of the next big questions will be a political one. The president promised in selling this plan that if you liked your doctor, you'd be able to keep it. The way some insurance companies are working, they're limiting some of the access to the doctors. That's something the president's going to have to deal with. It doesn't have anything to do really with the website. It just has to do with the implementation of the underlying program. And there will be some debate about whether those limitations on doctors are part of what the insurance companies are doing or whether it's a result of this law. It'll be politically charged, though, because people obviously like their doctors, and that will be an area of some political tension.
So, John, how much longer do you think the president has to kind of get this working, or at least get most of the problems behind him, before it becomes a significant political problem for the congressional elections next year?
Well, I think it's going to be a political problem for the elections next year. I think what the president needs and what Democrats need is two things. One, they need lots and lots of stories of people signing up. There are still lots of people signing up through these websites in the states that are working. Also, a lot of people getting on Medicaid. So there are some good stories out there. What they need now is to match the signups in the states with the federal system. Then the president can say all of these people who were shut out of the system before, who were worried and anxious about their health care coverage, they no longer have that worry, and that's a good thing in their lives. If he can start talking more about that, then maybe that pushes down some of these bad stories. Then the other thing they have to worry about is some of these, this is a law that was meant to disrupt the insurance system. And those disruptions are just going to cause some issues going forward. That's sort of the way the law was intended. Handling those issues, being able to meet people's fears as they have them, that will be a political challenge for the president and Democrats in the next year.
John Dickerson in Washington this morning. Thank you.